Hello everyone, welcome to the Radiology Gym. First I want to tell you, the private training session spots are fully booked. So if you want any private training session, send a message to the email in the description box. You will have to wait a bit, but we will arrange something. Don't forget, your brain is a muscle. If you don't use it, you'll lose it. I'm Dr. Ahmed Dia Abdul Wahab and I'll be your coach for today. Stay with me. Well, hello dear. Welcome to the Radiology Gym.
Hello, my coach. How are you?
I'm fine, thank you. What about you?
I'm good. I am ready for my exercise and I want to do a training session with you.
Okay, that's a good idea. So, let's start.
Okay, sir?
So, this case is for a 1-year-old child who's presented with congenital scoliosis. So, MRI of the whole spine was recommended for evaluation.
Okay, so this is an MRI of a 1-year-old child who was presented with congenital scoliosis. And I can see here this is the myelogram or a coronal view of the limbosacral region. And on the myelogram, I can clearly see there is some sort of dural ectasia or dural anomalies, and we can use other images for further evaluation. Okay, so these are the sagittal images of the whole spine of this child, and we can clearly see that here there is some sort of vertebral anomaly at this level, and also it's obvious that there is a tethering of the spinal cord. We can see that the spinal cord is attached to the level of, I think, S1, and it's tethered past the area of the vertebral anomaly. We need to see more images for better evaluation. These are the T1 weighted images, and here we can see again there is some sort of vertebral anomaly at this level, and we can see the spinal cord tethered here. I want to see the sagittal myelogram. Okay, so this is the sagittal myelogram. Again, there is some sort of dural ectasia around the lower lumbar and sacral levels. And if we go to the axial T2 weighted images starting from top to bottom, and here we can see, obviously there's diasteatomyelia. We can see that the spinal cord is split in two. There are two spinal cords here splitting and going into two different dural sacs, and they're separated by this structure, which is obviously a bony spur. So there's a bony spur dividing the thecal sac into two thecal sacs with two spinal cords, and as they go down, they are tethered to the level of, I think this is a S1, and associated with reunion of both dural sac, resulting in the dural ectasia. However, we can see that there is no sign of any spina bifida aperta. The skin is intact and there is no skin opening.
Good job. What else?
Probably we can do T2 fat saturated images. So these are the sagittal T2 fat saturated images. We can clearly see that there is a large dural ectasia here, and we can see a big bony spur, which, as we discussed earlier, dividing the fecal sac, and probably coronal images would be very helpful here.
Finally, I wanted to ask whether you needed coronal images or not.
Of course, we need it in this condition. So these are the coronal images, and obviously we can see here the vertebral segmentation anomaly. There is fusion or near complete fusion of, I think, L3 and L4 vertebral bodies. And these are the vertebrae that are causing the bony spur. As we can see here, this is the bony spur, beautifully demonstrated how it's dividing the tethered spinal cord into two cords, and they are united distal to it here and tethered at the level of S1.
Well, that was a very nice approach and good interpretation of the case. However, did you forget something important to comment on these cases?
Well, I don't know, sir. Probably. I can't think of anything. If you can help me.
Sure, I'm here for that. In cases of congenital abnormalities of the spinal cord, always look and think about the base of the skull, the level of the foramen magnum here. You need to see if there is any sign of herniation of the cerebellum or any abnormality at the craniocervical junction, because sometimes there is an important pathology here, like some sort of Chiari malformation. This is the first thing. And the second thing, you need to not focus on the main pathology, which is the bony spur and the diasteatomylia, and as we discussed before, but also look at the rest of the spinal cord. For example, here. Look, is there any sign of syringomyelia, for example, any other tumor or cyst or whatever? So you need to comment. Of course, here there is nothing, so you need to comment on the craniocervical junction, the spinal cord at the cervical level, and the rest of the spinal cord if there is any syrinx or any other pathology.
You're completely like my coach. Sorry for that.
No problem. We're practicing just for that. So next time you won't forget it. Good job. Thank you. Keep coming.
I will, sir.
And keep training.
Yes, sorry.
Thank you very much. See you later. Bye-bye. So this was our exercise for today. Don't forget, like, subscribe, share, and tell your friends about us. Keep coming to the gym. See you later. Bye.